British Columbia's provincial labs are seeing whether artificial intelligence can help diagnose diseases like cancer more quickly. The province says new digital tools will allow researchers to securely share high quality images in other parts of BC and get faster diagnosis or a second opinion. The federal government's Pacific Economic Development Agency of Canada and the province are spending $2.65 billion on 3 projects. The province says this will especially benefit healthcare delivery in rural and remote areas. The BC government says there are more than 4,200 publicly funded diagnostic tests available in BC, which result in more than 96 million tests annually that need to be diagnosed. I'm now joined by Dr. Abhishek Rout, Medical Director at Appletree Medical Group. Dr. Rout, thank you for joining us today.
Good evening.
Can you walk us through how exactly AI can be used as a tool to diagnose cancer more quickly?
Absolutely. So it starts with training AI models first. You have an AI model for cancer diagnosis. The developers will provide it with a lot of high-speed version training that specialists would normally undergo. For instance, you can have an AI model with millions of previous mammograms, each labeled healthy or showing signs of disease. And with this process, the AI learns to recognize patterns on the images, so it distinguishes healthy tissue with potential cancer indicators. So once you have that, then you have an AI model that can examine mammograms, for instance, and identify these subtle features that might indicate breast cancer. But you could do that with other things as well. You could analyze pathology slides to detect abnormal cells associated with various cancers. So AI tools can really assist in a diversity of tests and help pathologists by really looking at high quality images and very quickly providing an assessment on whether this could be cancer or not.
Now, how exactly should AI be used in medical practices, and where do we draw the line between relying on a doctor and relying on AI?
I think that's a great question. I think what we're seeing is looking at AI-assisted diagnosis. So AI can analyze medical images, like we just spoke about as well, and it can assist in clinical decision making. AI is very useful in handling administrative tasks as well. So that's something where we should really be leveraging AI. And patient monitoring. So wearable devices and sensors oftentimes collect real-time data, and AI algorithms can really help with figuring out if they're at risk for certain diseases. I think there's a big question of where to draw the line. I think AI should really augment, not necessarily replace, healthcare in that case. And we should also let the doctors handle the more complex, nuanced cases, so where we're dealing with empathy or holistic understanding of the matter.
And what are some of the positives of this new technology? Could it help alleviate some of the workload for doctors and reduce instances of human error?
Absolutely. I think even looking at the example in BC, there's a sheer volume of diagnostic tests. So it's 96 million tests done in BC annually. So if we have the support of AI, we could really bring that down and alleviate that huge burden. We're also looking at efficiency and workload alleviation. So no one went into medical school to do documentation, and certainly AI can be very helpful in assisting with those encounters as well. But like we talked about, I think the big parts of AI that's very exciting from a cancer perspective is the predictive analysis and early detection.
Now, you touched on human empathy, but what do you feel are some of the potential negatives or things to look out for moving forward?
Yes, I think this is the big concern here as well. So the big concern we have is the garbage in, garbage out. So AI models learn from training data. If that data is biased or incomplete, then you have created an AI model that is also biased. So that is a big concern. What we do know is there's not a lot of transparency with AI algorithms, and most of them are actually quite black box models. So doctors don't exactly know how these AI algorithms work. And finally, there's privacy concerns as well. So AI is now processing sensitive health data, and we need to ensure that patient privacy is really critical in that sense.
And how is the medical community reacting to the idea of using AI?
I think we're seeing an interesting picture here. So if we look at some of the studies from the American Medical Association, 41% of doctors were very excited in bringing AI into their practice, and 41% were concerned. And so what we see here is basically a mixed picture. If we look at the public perception as well, we have some American data. 60% of Americans would feel uncomfortable if their healthcare provider relied on AI for diagnosing disease or recommending treatments. and 57% believed that using AI for tasks like diagnosis and treatment would worsen the patient-provider relationship. So I think we have a long way to go to accepting AI and really classifying what we should use AI for in healthcare.
Dr. Rout, thank you so much.
Thanks so much for your having me.
All right, don't go anywhere. We'll be right back after the break.